Hello from Amber, Devin, Brian, Chelsea, Alicia, and Teresa. We will be presenting on pediatric indoor mold exposure.
So when coming to understand pediatric indoor mold exposure, it's very important to understand the very basics of indoor mold in general. Molds are a fungi that can be found both indoors and outdoors. So they tend to grow best in warm, damp, and humid conditions and spread and reproduce by making spores. So you'll see them a lot more often after flooding situations or leaks, things like that. Many people can be sensitive to mold and can have a variety of serious reactions. And the most vulnerable populations when it comes to mold exposure are workers such as farmers, people with weakened immune systems, and those with asthma.
As we previously stated, vulnerable and sensitive populations may be sensitive to mold exposure. Symptoms of mold exposure may include nasal and sinus congestion, runny nose, eye irritation such as itchy, red, watery eyes, respiratory problems such as tachypnea, wheezing, difficulty breathing, chest tightness, and cough, throat irritation, skin irritation such as a rash, headache, and persistent sneezing. These symptoms may make it difficult for an individual to continue out daily activities of living, including work, school, and simple activities like getting groceries or walking to pick up kids from school. Asthma can be exacerbated by mold exposure, including common molds such as Alternaria, Cladosporium, Aspergillus, and Penicillium. Children with asthma are at increased risk of asthma exacerbation due to frequent mold exposure risks at home and in school, where they spend much of their time. As mold exposure increases, the number of asthma-related symptom days, unscheduled clinical visits, and hospitalizations also increase. In asthma exacerbation, airways become swollen and inflamed and produce extra mucus, resulting in shortness of breath, difficulty breathing, coughing, and wheezing. This is also known as respiratory distress. Asthma exacerbation can be classified as mild, moderate, severe, or life-threatening based on symptoms, physical examination, lung function, and oxygen saturation. Management of asthma exacerbation depends on the episode classification and whether the episodes are acute or subacute, ranging from home treatment with an inhaled short-acting beta-2 agonist to hospitalization with intravenous corticosteroids. A person with asthma cannot eliminate their risk of asthma exacerbation. However, they can reduce their risk by minimizing exposures to things such as mold and following professionally prescribed treatment plans.
The development of childhood asthma can interfere with a child's ability to play, sleep, and exceed in school. Asthma in children is a leading cause of emergency department visits, hospitalizations, and missed school days. Some warning signs that your child might be suffering from asthma are wheezing, persistent cough, or chest tightness. If your child is displaying warning signs of asthma, a diagnosis by a physician is needed. The physician may take a thorough medical history, ask about the characteristics of the child's home and environment, and perform a lung function test. Some of the triggers that might affect the asthma are exposure to tobacco smoke, living in urban areas, previous seasonal allergies, and unfit living conditions. Once your child is diagnosed, there are 4 levels of severity that can be categorized: intermittent, mild persistent, moderate persistent, and severe persistent. The least severe being intermittent, and the most severe being severe persistent.
Okay, so pediatric mold exposure in schools. Studies showed significantly more classrooms, about 15% reported signs of mildew as compared to homes. A study of 180 samples from 12 schools showed 100% presence of mold in those classrooms. There was even high and variable levels between these classrooms, which suggests that classroom-specific exposures may be important sources of irritant or mold. Overall, there's a lack of information of mold in schools, as most studies have been performed in homes or in sick buildings, such as hospitals and nursing homes.
Depending on the cause and timing of mold growth in homes, it may be the first place of exposure for many individuals. Homes consist of structural and biological elements that make them vulnerable to moisture via appliance and piping issues, building materials, cracks, and other structural damage. However, isolating the cause of pediatric asthma and other health complications associated with mold exposure within the home can be complex due to a variety of factors. Determining the source of mold and then the extent to which the mold is harmful has been a point of research and has been important for understanding the threshold at which household mold exposure causes harm and health issues. The literature shows that children living in homes with mold exposure at baseline have been revealed to have a greater than 100% increased risk of developing asthma in the following 6 years post-exposure. However, this is not seen with just mold, the appearance of mold, or the beginning signs of mold. It has to be the point at which mold is producing an odor. In addition to these factors, understanding the variables that determine harm and mold exposure that impact, it is also really important to consider parental health and the heredity of these different health complications. It is by isolating those variables, it makes it easier to determine whether there is truly an environmental causal agent, and if it is the mold that is present in the household that is truly causing the health issues.
When it comes to assessment, there's actually not a lot to be done. The EPA currently does not have any standards for mold or mold spores, so it's difficult to have standardized or frequent testing in school settings. Unlike this, with a carbon monoxide tester, they can go in and check and make sure it works every month, make sure the levels are okay, but with no standards, it's difficult to do that. Past that, testing can be expensive and time-consuming, and oftentimes even unreliable. So usually it's up to just the human eye to best assess for mold. According to Healthy Schools Network, a lot of the time they tell you to do walkthroughs. So they tell you to look at each part of the room, don't touch any mold you find, and go through likely spots for mold. So if the carpet is wet or anything like that, that might be a place you want to check. It tells you to pay attention to any water stains, check inside closets and boxes, look behind furniture, check all of those precarious spaces, especially if it has a mold-like scent. It also tells you to look up. Oftentimes ceilings can be extremely damp, and this is a very important place to check for mold, especially in schools where children might be exposed. Really the only time that they suggest that you do sampling is if symptoms persist and mold is not visually found. So if it does reach a point where it's decided that it's necessary to sample for mold, there's generally 4 different types of sampling that will be performed. Those 4 different types are air, surface, bulk, and swab. So with air sampling, it's actually the most common form of mold sampling. Essentially what you do is you sample both the indoor and the outdoor air, and then you're going to compare those mold spore levels to see if there's a spike somewhere. It's really nice because it can help you identify if there is a hidden mold somewhere nearby, but the tricky part is that it can't identify the source of the mold, so you can't tell if it's coming from the ceiling or in the floor or behind some piece of furniture. The next type of test is surface, so it measures mold spores on indoor surfaces by collecting it on tape or in dust. This can be useful, but a lot of the time it will mostly help you identify what the type of mold is, not so much if there is mold, because usually you'll be able to, you need to test it from the source, so you have knowledge of the source in advance. Similarly, this often happens with bulk. You remove the moldy material and you can quantify and identify the type of mold. And similarly, there's also swabs. So you're going to go ahead and take a cotton swab and rub it across the potentially contaminated area and go ahead and take it to the lab and test it. So really, 3 of these 4 methods, oftentimes you'll know where the mold is coming from. And have some idea that there is mold, and really you're just testing to get a quantity or identify the mold. So really, the human eye, again, is the best form of sampling for mold.
Mold remediation in schools involves identifying moisture problems through proper assessment and then acting quickly to remove the source of moisture. The most common Sources of moisture and potential mold growth in schools come from roof and plumbing leaks, landscaping and gutters, condensation, excessive humidity, and delayed or insufficient maintenance. The CDC recommends establishing a remediation plan prior to attempting any mold cleanup in a school. This plan should include assessing the scope of damage, choosing a qualified person to manage the remediation, deciding whether to hire a professional or do an in-house cleanup, determining whether hidden mold may be present, and ensuring the use of appropriate personal protective equipment. Generally, remediation will include containing the affected area with plastic sheeting in order to help reduce exposure, thoroughly drying the affected surfaces as soon as possible to prevent further mold growth, cleaning up and disposing of contaminated materials even if the mold has been killed because dead mold spores can remain toxic, and being sure to monitor the health of building occupants. It should also be noted that in the case of contamination by sewage, chemical or biological pollutants, or if building occupants report serious health concerns, an experienced professional should be consulted. This diagram illustrates the CDC's recommended process and key steps for mold remediation. So if moisture or water damage occurs and is discovered within 24 to 48 hours, acting quickly to address the problem can help eliminate the need for a full-scale remediation. Steps should include discarding all water-damaged materials, including books, papers, ceiling tiles, and insulation, removing damaged wallboard and paneling, and allowing wall cavities to ventilate if possible, cleaning surfaces with water and mild detergent before allowing them to dry, using an extraction vacuum to clean up excess water, and then using dehumidifiers, fans, and/or heaters that are set to mild or low heat to facilitate the drying. If more than 48 hours has passed since water damage has occurred, or in the case of a more serious mold problem, the CDC recommends a more cautious or conservative approach. Use a wet vacuum to remove accumulated water from floors, carpets, and hard surfaces. Damp wipe and scrub surfaces with plain water or with water and a mild EPA-approved detergent. Remove water-damaged materials, seal them in plastic bags while in the containment area, and dispose of normally. And then after the contaminated material is completely dry, use a HEPA vacuum for final cleanup and dispose of the contents of the HEPA vacuum in well-sealed plastic bags. Relocatable structures, commonly known as portables, are somewhat notorious for mold issues, partly because of cheap construction materials and because of poorly functioning HVAC systems that can increase humidity and that don't provide proper ventilation. The CDC provides an extensive list of considerations for maintaining air quality in portable classrooms, which can be accessed via the link provided below. However, some key recommendations specific to mold are to ensure that outdoor intakes are not located underneath portable units, which can increase humidity, and to be sure to routinely inspect HVAC systems, including air plenums, ducts, coils, drain pans, etc., for mold growth, and use only EPA-approved formulas for cleaning and disinfecting. Also, it's recommended that portables not be placed in areas where standing water collects after rain, and to try to avoid having carpet in classroom entryways, or at least provide waterproof mats for drying shoes and clothing. Another option is to consider building covered entryways to portables that are equipped with outside entry mats.
Here are our citations where we got all of our information in case you want to look any further, and feel free to email any of us if you have any further questions. Thank you.